Good morning, everyone. I'm Dr. Rohan Basak from Chennai, and today I'd like to share my study, Aqueous humour metabolonomics in pseudoexfoliation syndrome, key to complications in cataract and glaucoma. To begin with, I have no financial interest to disclose. Pseudoexfoliation syndrome is a multi-organ inflammatory disorder with deposition of grayish-white flecks of basement membrane-like granulofibrillar material in various ocular structures. Although its origin is unknown, its looming presence heralds serious complications like cardio and cerebrovascular disorder, dementia, and sensory neural hearing loss, among other ocular problems.
Please help him change the slide.
Yeah.
Okay.
Our aim was to compare the aqueous humour composition in patients with and without pseudoexfoliation syndrome. This was a prospective case control study at a tertiary care hospital in Chennai from December 22 to May 23, enrolling about 22 patients with and 22 without the disease. Adults consenting for cataract surgery were included, and those with pseudoexfoliation syndrome were added as cases with appropriate age-match controls. Those with existing glaucomatous changes, connective tissue, and metabolic disorders were excluded. After enrollment, 0.2 ml of aqueous humour was collected during the surgery and metabolites assessed using quantitative ELISA. The analysis was done using the CV ANOVA test. As the results go, there was no statistical difference noted between the mean age and the genders of both cases and controls. Majority of the patients with pseudoexfoliation syndrome were found to have nuclear sclerosis grade 3 cataract, as opposed to those without the disease, with a nuclear sclerosis grade 2 with a posterior subcapsular cataract. On analysis of metabolites among the cases and controls, the XFS patients showed a significantly higher mean values of ergothioneine, indole acetic acid, and hydroxyantranilic acid, probably indicating their minor role in zonular metabolism, whereas the non-XFS patients had low values of serine and nitric oxide. Detailed metabolite comparison revealed significant differences in the levels of all amino acids except the previous mentioned three, which is ergothioneine, indole acetic acid, and hydroxyantranilic acid, with the XFS patients having lower levels of all amino acids in general as compared to their controls. The most significant reduction, though, was noted with homocysteine, with a p-value of 0.001. Understanding the XFS pathogenesis helps in unraveling how the complications unfold. In keeping with previous studies, significant reduction of 7 key metabolites used in the cysteine, methionine, arginine, and proline metabolism was noted in our study, thus pointing to their paucity for crucial processes like the zonular metabolism and antioxidation processes. To conclude, pseudoexfoliation syndrome appears to be caused by increased oxidative stress, and identification of causative metabolites may help in innovation of drugs to delay its complications. Like any other study, our study too has room for improvement. This study recruited few participants and was restricted to a small area, interfering with its generalization. There was no assessment of complications, and the gold standard test for analysis, which is liquid chromatography and mass spectrometry, was not used in view of financial constraints. Thank you.
Thank you.